Good afternoon, everyone. It is great to join you today for today's announcement as the MC. My name is Darlene Roden, and I'm the MLA for Batoche. I would like to begin by acknowledging that the land which we gather is Treaty 6 territory, the traditional and ancestral lands of the Plains Cree, Saulteaux, Dakota, Nakota, Lakota, and home of the Métis. I am excited to be joined today by the Honourable Jeremy Cockrill, Saskatchewan Minister of Health, and the Honourable Mark Holland, Federal Minister of Health. I would like to start by introducing our speakers here today. Minister Cockrill was first elected as member of the Legislative Assembly for the Battlefords in 2020 and was re-elected in the 2024 provincial election. He previously served as Minister of Education, Minister of Highways, and Minister responsible for Saskatchewan Water Security Agency. Minister Holland was first elected as the Member of Parliament for Ajax in 2024. 2004, sorry. As a Member of Parliament, Minister Holland has served as Leader of the Government in the House of Commons, as Chief Government Whip, as Parliamentary Secretary to the Minister of Public Safety and Emergency Preparedness. In both public and private roles, Minister Holland has backed health-related initiatives. He served as Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth. I would now like to invite Minister Cockrill to make today's announcement.
Thank you, Darlene. Good afternoon, everyone. It's a real pleasure to be here at Jim Pattison Children's Hospital, and I'd just like to quickly thank the folks with the SHA, the folks that work here in this facility. Minister Holland and I had a brief opportunity to tour some of the wards on the facility and just reminded of really the great work serving Saskatchewan residents and families who are going through some challenging health journeys. I'm pleased to join Federal Minister Mark Holland today for the signing of the National Strategy for Drugs for Rare Diseases. The Government of Saskatchewan is pleased to partner with the federal government to benefit Saskatchewan residents and communities through the agreement that we will be jointly signing today. Thank you to both the Provincial Ministry of Health and the Health Canada officials who have been working on finalizing this agreement over the last number of weeks and months. This $40 million bilateral agreement will help to support investments already underway in Saskatchewan to improve health care for those residents with rare diseases. Today's funding will help us enhance our coverage for 3 drugs, 2 that treat extremely rare cancers, and 1 that treats a rare inherited condition that affects kidneys. The Government of Saskatchewan already provides coverage for the cost of these 3 drugs, but as a result of today's agreement, this will contribute to the provincial investment already occurring to cover these drugs, which helps to sustain Saskatchewan's publicly funded drug plan for this generation and future generations. The Government of Saskatchewan is committed to providing high-quality, accessible health services and programs to our residents. And this agreement and this partnership with the federal government is important to the ongoing commitment of both the federal and provincial governments to improve access to innovative treatments, early diagnosis and screening, and coverage of these high-cost drugs. I look forward to the continued work to improve the health and well-being of Saskatchewan residents. I'd like to thank Minister Holland for being here in Saskatchewan today. And I'd now like to invite Minister Holland to make a few comments. Thank you.
Merci beaucoup, Jeremy. J'apprécie ça énormément. C'est un grand plaisir d'être ici avec vous vous tous. C'est un jour, je pense, important. C'est la transformation de notre système de santé, c'est absolument essentiel. Parce que la situation actuelle, c'est pas acceptable et c'est pas durable. Et ça, c'est la raison pour laquelle c'est absolument essentiel qu'on travaille ensemble, tous ensemble, pour la transformation que notre système de santé a besoin. And this is an important step in that journey. And it's great to be here in Saskatchewan. This is the home of our healthcare system. This is where some of the most important innovation in health has occurred. And, you know, I just had an opportunity, Jeremy, with you, with the people behind us, tour what is just an exceptional children's hospital. The Jim Pattison Children's Hospital is, I think, one of not only the most innovative, special places in Canada, I would say really it is in the world. You know, walking through here, I can't imagine how joyful it is to work every day. This is a place of not only care, I mean, so much care put into how patients are dealt with and thinking about the patient experience and thinking about the experience of the families of the patients, but thinking of innovative ways about how to deliver care and how to attack legacy and bring change, which is not an easy thing. But our health system needs change. Most of the things that fill our hospital rooms and our emergency rooms and our doctor's offices are preventable. 70% of chronic disease and illness is. And we're in a time where technology, I was thinking of Tanya, who's one of the doctors here, was showing us that robot, which is incredible, and her being able to say that she can, with telepresence, put herself instantaneously from this children's hospital or from her home directly into an emergency situation. But we have to rise to meet that challenge, and that transformation is absolutely critical. And you know, one of those pieces that's absolutely essential is ensuring that people have access to the medications that they need. And let's talk for a second about rare diseases. You know, 1 in 12 Canadians is going to get a diagnosis for a rare disease. It's a spin of the roulette wheel. You know, there's no idea whether or not it'll be you or somebody that you love that it lands on. And it's hard enough to deal with a diagnosis of a rare disease. I get an opportunity to talk to patients across the country who get that first bit of news. And the people behind me know what that means to a patient or to that patient's family. And can you imagine, it's hard enough dealing with how are you going to navigate the health system? How are you going to get the care you need? How do you deal with what that diagnosis means? But then on top of that, to ask, how are we going to pay for it? How are we going to pay for the life-saving medication that's going to keep the people that we love alive? And so this journey together, working this $40 million bilateral agreement that Jeremy and I are going to sign here today, is so important in that journey of making sure that people can afford the medication they need, that when they're in a catastrophic situation, that we have their back, that we're not going to let them be alone in this journey of getting back to good health. And for me, it continues a conversation on pharmacare, because I believe it is a fundamental truth that it is not only logical that every person who is sick has access to the medication that they need. It not only makes sense for their health and is a matter of social justice, but it's just plain dumb to do anything else. You know, you take diabetes. We spend over $30 billion a year in diabetes in this country. So much of that cost comes from people not being able to adhere to their regime in terms of the medication they need to take and the things that they need to do in their life. I'm talking to doctors who say to me, why am I even seeing this patient? Because they cannot afford to take the medication that I'm prescribing to them. We need to end that. So I'm working closely to talk with provinces across the country about pharmacare, about making sure people get the life-saving medication that they need. And today's an important step in that. So too, and I think I want to just spend a second here talking before I talk about the interpretation letter, and then we're going to take your questions, is dental care. You know, I was saying to Jeremy, we had a great opportunity to talk before we took the tour, that we have a lot of latent capacity in our health system. And the fact that we've now seen over 1.3 million Canadians who've gotten dental care. These are people who didn't have access to care before, who got care and may not have otherwise. These are people who we've now detected oral cancers and saved them from getting really sick. Or we've created a situation where we recognize, because oral health is primary care, that they go in and find out that they're hypertensive or that they're potentially diabetic. Or that they're just finally getting that smile that they're proud of, so they get a family photograph and smile with pride. That happened because hygienists and dentists and denturists had space to be able to see additional patients. So we use the excess capacity of our health system to ensure more primary care is delivered. And it shows what's possible when we work together. I would say that the interpretation letter, and Jeremy, you and I had an opportunity to talk about this, the interpretation letter on making sure that we have a Canada Health Act that allows professions, health professionals, registered health professionals to practice at top of scope fits exactly into that. If we have a nurse practitioner who has extra capacity and they have a patient in front of them and they have the skills and qualifications to be able to help that patient, well, for goodness sakes, they should be able to help that patient. They shouldn't have to refer them to a doctor. It's the same thing with a pharmacist. It's the same thing with a midwife. It's the same thing with every registered health professional. We've got to be all in, pushing with everything that we've got everywhere. And, you know, you see it. It's so emblematic here in this hospital. As we walk the hallways and have a conversation, they're so focused on the patient. How do we make changes to help the patient? How do we become more efficient? How do we interrogate our legacy systems to be better? So this change in the interpretation letter is critical. It allows practices to practice at top of scope. Look, we have a wonderful conversation coming up in Halifax. You know, Jeremy and I and the health ministers from across our great country are going to meet in Halifax, and we're going to have a meeting at the end of the month talking about the incredible opportunity of transformation to move from a system of illness to a system of prevention, to move from, yes, hospitals, but really to be in communities, to be attacking things before they happen. To move from analog to digital, to deal with the challenges in having interoperability in a connected system. So we have an important thing to do there. And I know there's a lot of frustrations with our health system. But walk the halls of this hospital. See the miracles that are performed here. We have a lot to build on, things that we shouldn't throw away. And remember this, and I'll close on this. Canada has a huge advantage. You know, when it comes to health span, Canada is second in the G7 only to Japan. What does health span mean? It's the number of years we're going to live in good health. And my mom, who is 80 years old and tailgating at Bills games and, you know, going out and having the time of her life, I want that for everybody. I want our last 10 years of life to be filled with joy and happiness, free of disease and sickness. And we have an advantage that we can build on there. Canada is, we have one year longer than France and Italy that we spend in health, 2 years longer than the United Kingdom, 6 years longer than the United States. Yes, we must measure GDP and economic output, but alongside it should be the number of years we spend in health. And we have a huge advantage that we cannot give up and that we must keep pushing, because Canada can be and must be the best place in the world to age, to live in health, in joy, in productivity. And what a wonderful place, in this place of miracles and joy, to be able to make this announcement today. Merci beaucoup.
Thank you, Minister Holland. So now you're going to sign, right?
I think we sign.
Yeah.
Do we sign first or questions first?
We have questions first.
Sorry.
Questions?
Okay.
Welcome, everyone. Bienvenue à tous. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question with one follow-up. Nous commencerons par les questions dans la salle avant de prendre les questions sur le Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question et un suivi. Let's proceed with the first question. On commence avec la première question.
For anybody in the room? Yeah.
Hello, I'm Nicole. I'm with Global News Saskatoon. I just have a couple questions here for Mr. Cockrill first. So with the strategy, you know, it offers coverage for 3 medications. Yeah. Is there any plans to help cover, or I guess help with screening for rare disorders for kids, and also helping retain specialists in the province for people who are looking for these types of medications?
Absolutely. You know, I'll talk about the specialist question first. And you know, I'll highlight up here Dr. Terry Clausen, who's our provincial head of pediatrics here in the province of Saskatchewan, joined us kind of in the middle of 2024. And I got to say, Dr. Clausen has done an incredible job helping to recruit subspecialists and specifically pediatric specialists into our province. Dr. Clausen has practiced and worked in provinces all across the country. This is part of our Health Human Resources Action Plan. I was at the University of Saskatchewan yesterday talking about our post-degree Bachelor of Science in Nursing program. We're training more nurses, we're training more specialists, we're training more doctors, as many as we can in this province. But we know that we also need to be recruiting from other provinces and other countries as well. Dr. Clausen's been a key part of that. So, of course, the work continues to attract specialists. I think we've had a good run in the last year in terms of filling some of the vacancies that were challenging. Families and patients specifically that use this hospital, there's certainly more work to do. We're not taking our foot off the gas pedal there. Dr. Clausen and I will be talking regularly over the next several weeks and months. The questions around screening and diagnostics for younger patients, certainly something that we will always be taking a look at in concert with the Saskatchewan Health Authority and, facilities like this and around the province. So again, it's another area where there's more work to do. I'm really encouraged by the work that is happening here with our specialists, with our healthcare workers in this facility, and again, through the work that Dr. Clausen has done. But there's definitely more work to do, and we're always focused on, again, how we make Saskatchewan the best place to live, work, and raise a family, and that raise a family piece is a key part of that, and making sure that, especially for our pediatric patients in the province, that we're providing the best opportunities possible.
And then just my follow-up here is for a colleague of mine. It's on the cover nurse practitioners and other primary care providers. So what are your thoughts on the recent federal announcements stating provinces will be mandated to cover nurse practitioners and other primary care providers starting next year? Is a province on board, and could this alleviate the pressure on Saskatchewan doctors, making it easier to access care in our province?
I think it aligns with what we're doing already in the province. I mean, you talk about, and this was talked about in our throne speech in the fall. Our goal as a government is to make sure that every Saskatchewan resident has access to a primary care provider. That might be a family physician in your community, that might be a nurse practitioner. Some of the work that we're doing specifically around nurse practitioners in terms of setting up clinics that are run by nurse practitioners. That is something that we haven't seen yet in this province. We're working hard with nurse practitioners in this province. I think there's massive opportunities for NPs, specifically in our rural and remote communities. And so that's something, and the interpretation letter that came out yesterday, again, I think it aligns with what our province is doing, what other provinces are doing, of having nurse practitioners as a key member of that primary care team across our country.
For you, Minister, Mia with CKUM News. I guess I'm just looking, how many people will this help, and is there a growing need for something like this in the province?
Yeah, again, these are rare diseases. So they affect, with these three drugs specifically, they affect a fairly small number of patients in the province. So just given that, for privacy reasons, I won't share the specific numbers of these three drugs. But again, whether it's one patient or 100 patients, when we are able, again, working with the federal government to provide coverage, that eases the pain, eases the burden of cost on that family. So again, whether it's one family or 100 families, this is a good announcement for Saskatchewan people.
For sure. And my follow-up is from a colleague as well. The NDP has been vocal about this Fred Sandusky. He only has weeks to live, but he's worrying about paying for his end-of-life care. And he says the provincial government has not helped him, I guess, fund this. Why hasn't this been done, and what do you have to say about that?
I'll just say, with Mr. Sandusky's case in Weyburn, I got to say, our local MLA in that area, Michael Uyghur, has been in regular contact with Mr. Sandusky and his family. People from my office, people from Minister Carr's office have been in absolutely regular contact with the Sandusky family, again, trying to just help them navigate their journey through the healthcare system. I got to commend, again, our local MLA there, who's been in regular contact with the Sandusky family. I actually know that my colleague Minister Carr has a meeting with Mr. Sandusky next week, again, to discuss some of the challenges that him and his wife are experiencing, and we hope that we can find a resolution for that family.
Kira Miller with CJWW. Are you able to detail the two types of cancers in the kidney disease that these medications will target?
I thought you were going to ask me the name of the drugs, which I was concerned about because I've been working on memorizing those drugs. Yeah, so it's the first drug addresses Sézary syndrome, and then Oxlumo for the treatment of hyperoxaluria type 1, and then Epkinly for relapsed or refractory diffuse large B-cell lymphoma. So
Thank you. And have all other provinces and territories signed on to this national initiative yet?
I'll let Minister Holland answer that.
Yeah.
Saskatchewan is number 4. So this is our 4th agreement. We've signed agreements with BC, with Newfoundland and Labrador, and with, I'm going to come back on the other one. Alberta, of course, yes, absolutely. We just did Alberta. So with Alberta as well, Saskatchewan's number 4. And I'll just, because I have a second, say that this is the 3rd agreement with Saskatchewan overall. So had an excellent working relationship with Everett Henley. Everett and I worked on the Aging with Dignity and Working Together agreements as well. So I think there's a really great pattern of working together and finding solutions and finding common ground. And I think on health, that's exactly what people want to see.
Thank you.
I'm John Perez from Saskatoon. To Minister is there a plan to expand this like in the other types of cancer, or only in these 3 specific drugs for these rare diseases?
So I talk a lot about incrementalism, and I know that in a time of great challenge that incrementalism doesn't sound exciting, so I call it radical incrementalism. Like, we're going to try to do it as fast as we can, but as human beings, we only make progress one step at a time. And I think when you look at the totality of change that exists in our health system, it isn't possible to wave a wand and change into a different state overnight. And anybody who promises that is just not being straight with you. The way to do it is one step at a time. And the way that I like to think of it is it's rooted in science, data, and evidence. And what I believe is going to be shown as we move forward with these various interventions on making drugs more affordable is we're going to be able to demonstrate in data, in evidence, in evaluation that not only is it good for patient outcomes in terms of extending life, making sure that people avoid poor outcomes, but it's going to absolutely be game-changing in terms of cost. Already, I'll just take one example, which is, and I was talking about this with Jeremy, out in British Columbia where they led the pack in terms of contraceptives being free, they're already in their first year saving more money than it costs them for the drugs. And it makes sense, right? Because if you imagine the devastating effect of not being able to have access to medicine, if you take something like diabetes, you end up with a much more acute and serious condition. And that more serious condition is going to put you into a hospital or, God forbid, take your life. And I think we need to be thinking about it, and it's one of the great news in health. And I think it's one of the reasons why, Jeremy and I can disagree on a lot of different issues. But on health, it doesn't matter how you look at it, you come to the same conclusions. Not having primary care, not identifying problems early, not having people being able to afford their medicine, people not having access to care. This isn't just stupid because of poor health outcomes and people dying unnecessarily and getting sick unnecessarily. It's stupid in terms of cost. It's a broken way of doing things. And I think we have to call out into the night that it has to change. And what we're trying to do is step by step, inch by inch, make that change. And I'll try to do it with as many partners as we can, to do it as quickly as possible. But we have to live in a world where everybody affords their medicine.
To Minister Cockrill, it's related to, from my colleague, related to the Sandusky case. They are claiming that instead of helping Mr. Sandusky, the government is sending him bills. Can you comment on this?
Yeah, again, as I said earlier, our local MLA, Mr. Sandusky's local MLA, Michael Uyghur, has been working closely with the Sandusky family. And I'll just say that's not being reported, how our MLA is being in regular contact with that family, working with Fred and his wife. Folks from my office have been in regular contact with Mr. Sandusky as well. Again, Minister Carr is going to be meeting with this individual next week. And, again, committed to working to find a solution for the Sanduskys.
Hello, Jeremy Warren, CBC News. Question for Minister Holland. What do you think of the leadership rules and the entry fee? This is national politics now. And are they adequate to deal with foreign interference?
Yes. I know that the board is deeply concerned about foreign interference. We're in a time where There are a number of foreign actors that are attempting, and foreign countries that are attempting to interfere with our democratic processes. I am very confident in the processes and assurances that have been given to me that process will be one that ensures that only people who should be voting and people who we would want to see participating in a Canadian democratic process will be participating in that process. And that's exceptionally important. In terms of the timing, we don't have a lot of time. But, an election campaign is 37 days, generally. We can decide who leads this country in 37 days. Certainly 2 months is enough time to choose a leader of our party. And I think rightfully Canadians want us to get to the point. Let's get to it. And we have an incredible group of MPs and people within our party who are going to put their name forward. There's going to be a competition where those ideas are expressed and people can see the depth of our bench, the depth of the team, and the depth of our ambition for this country. And I'm very excited over the next 2 months to talk in a forward-looking way about the incredibly exciting opportunities that exist for Canada. I think you can feel my passion for the opportunities that exist in health. They exist in so many different aspects of this country. We're at a time of incredible excitement for this country. And I think that in a world that's felt very heavy, taking a moment over the next 2 months to talk about the ambition of this country and how excited we are for it and its opportunities is something I'm really looking forward to.
Thank you. Just a quick follow-up. Are you committed to running in the next election, or will it depend on who wins the leadership race?
I will oppose Pierre Poilievre with every fiber of my being. I will claw up any mountain to fight what he represents and what he would do to our country. There is nobody on our team that I would not support. I will absolutely 100% be fighting in the next election with every inch of my being.
Thank you.
Questions. Minister Holland, for my colleagues here, the Liberal Party has a tradition of alternating between a French and English leader. Given that Prime Minister Trudeau is from Quebec, do you think the next party leader should be from English Canada?
I think the next leader of the Liberal Party should have the greatest and most exciting, ambitious agenda for this country. I think that it should be the person who whose values and whose ideas most align with the values and ideas of Canadians and can match the incredible opportunities that this country has in front of it. And to me, that's the only criteria. I think, one of the things that's a great pleasure of, taking a chance to talk to, Jeremy as an example. Like, we can have all kinds of different ideas, but you meet people of incredible character. And I don't think we take enough time, maybe I can just stop and say outside of this process, to say that should be our focus. If there are people that put their province and their country and the people that they serve first and go with the whole dedication to themselves to do it, and they've got an ambitious agenda, like that should be the kind of criteria we're evaluating people on. I don't think people in Quebec or people in Saskatchewan, I don't think they're too vexed about, which part of the country that person comes from.
Mm-hmm. And do you think the next Liberal leader should remove the consumer carbon tax?
Well, I think we're going to have a debate, and I have to have an opportunity to talk with those leaders. We have to grow the economy and protect the environment, and so I look forward to a spirited debate on how to do both of those things. I was watching in horror and devastation with what's happening in Los Angeles right now. I wish I could say these events were isolated, but the truth is they are increasing both in their severity, their intensity, and their geographic location. There's no part of the world that is immune from the ravages of climate change. The debate about whether or not climate change is long over. And I think, the idea that we would be debating whether or not it exists in an election campaign is total fantasy to me. What we will do as a party, I am certain in that process, is come forward with the best policies to both grow our economy and protect our environment. Those two things are inextricably intertwined.
Thank you.
Hello, Luigi Palmieri for Radio-Canada CBC. So for you, Mr. Holland, question in French. Que pensez-vous des règles annoncées pour la course à la direction du Parti libéral? Est-ce que vous pensez que ça va décourager certains candidats?
Mais c'est absolument énorme, les quantités de travail, et c'est essentiel que les personnes aient prêt. Et alors, ce n'est pas le temps suffisant de considérer quelque chose, c'est essentiel que quelqu'un est prêt aujourd'hui. Parce que le course pour les directions du Parti libéral est vraiment petit, mais ce n'est pas un problème parce qu'on a une équipe extraordinaire avec beaucoup de personnes qui sont vraiment connues partout au pays et certainement à l'intérieur du parti. Et 2 mois, c'est absolument suffisant pour ça, je pense.
D'accord. Et maintenant, on revient sur le sujet. C'est quoi les mesures concrètes que les gouvernements fédéral et provinciaux ils vont mettre pour assurer en fait une mise en œuvre équitable de cette nouvelle stratégie?
Nouvelle stratégie aujourd'hui?
Ouais, de l'accès aux médicaments pour les malades.
Oui, c'est vraiment malheureux. Oui, qu'on parlait sur les questions d'équité ou de s'assurer qu'il y a les justices, mais c'est pas juste. Qu'il y a une personne avec le médecin, une autre personne sans le médecin. Ce n'est pas juste. Et pour moi, c'est vraiment difficile. Hier, j'avais eu une réunion avec les leaders autochtones en Alberta. Et la situation là, c'est pas acceptable, pas du tout. Et je suis certain que c'est le cas, pas juste ici en Saskatchewan, mais partout au pays, dans la communauté autochtone. Mais c'est la question d'améliorer la situation aussi rapide que possible. Et ça, c'est triste. Mais ce n'est pas juste, mais c'est la seule façon de réparer la situation.
Merci.
Merci. On va passer aux questions sur le Zoom. We'll go to the questions on Zoom. Thank you.
Merci beaucoup. If you are a journalist and you would like to ask a question, we would just ask that you raise your hand. Si vous êtes journaliste et vous voulez poser une question, s'il vous plaît, levez votre main. La première personne, nous avons Laura Osman de The Logic.
Hey, Minister, can you hear me all right?
Hey, Laura, I can hear you clearly, yes.
That's good. I wanted to ask you about the interpretation letter, which, when I understood former Health Minister Duclos, when he first brought up this idea, it seemed like a crackdown on virtual care providers who were charging patients for access to online appointments. This letter makes no specific mention to virtual care, and it seems like some virtual care providers are not entirely sure if this applies to them or not. Can you provide any clarity about the scope of this interpretation letter and whether it applies to companies like Maple and others who have sort of fee for appointment structures?
So thank you, Laura. So in the first order, no. The decision was deliberately made to divide the interpretation letters. This interpretation letter deals with scope, and I spoke a little bit about that in my opening comments. The second interpretation letter will deal with virtual care. And one of the things that I've said throughout this process is consensus, if possible, is absolutely essential. When we change the Canada Health Act, it will be forever and ever. And I think where we can do it in collaborations with provinces and territories, it's exceptionally important. We've been having really good conversations at both an official level and directly with ministers provincially and territorially. And we have this meeting coming up in Halifax, which I think is going to be incredibly important to talk through some of these details. In my view, certainly, absolutely, and I would say this to any provider who's attempting to calcify or to grow their infrastructure virtually. The Canada Health Act, at its core, states that Canadians don't pay for care. It's a very important precept that when you walked into a doctor's office, be it a virtual doctor's office or a physical doctor's office, that you're not in a circumstance where you're pulling out your credit card or your debit card. And that matters fundamentally because if you imagine virtual care expanding, that if the tools of virtual care are private and therefore only accessible if you have money, then it'll be left to the public system to deal with those that are the most vulnerable and often the ones who most need it, rural, remote, folks who are First Nation, Inuit or Métis. And so they're not going to be able to afford those technologies. It makes sense to me that whatever tools we have, that we allow all kinds of innovation within the system, but that precept that the patient doesn't pay and that it's universally accessible is absolutely essential. So I continue to say that, but I also recognize that we have a little bit of time, not a lot of time, for me to continue these discussions with health ministers so that we can get to what I think we need to do.
Thanks for the clarification. In terms of timelines, do you expect this second interpretation, specifically on virtual care, after you've had these conversations in Halifax with your counterparts, to follow a similar timeline outlined in this interpretation letter so that it all comes into effect at the same time in April?
That's too hard to say. I don't want to be prejudicial to those conversations. They are ongoing. I would say that the way that all of these conversations will go, as I'm sure you'd appreciate, it's impossible to get all of us in a room together, right? So I've had one-on-one conversations with every health minister on this subject. I have, our officials have been talking, and we have an extremely important conversation that's going to come together as we're all together and can kind of have a conversation and understand this. So at this point, I understand the desire to have that clarity. I have that desire, but I don't think that those conversations have advanced sufficient enough to be able to give you clarity as to a date.
Perfect. And now we have a question from Tessie Sansi from the Hill Times.
Hi, thank you for taking my question. Minister Holland, I'll direct my questions to you. I also am looking for some clarity on the CHA letter. So since virtual care is not a part of this letter, this is just a simple list. So midwives, nurse practitioners, and pharmacists are the only professions covered in this letter, correct?
Well, no, it's all registered health professionals, and it's up to the provinces to determine scope. But the provinces have the power under this interpretation letter to be able to take any registered health professional, if it's a service that they are qualified and able to deliver, that they can deliver it in place of a doctor, and they could charge the same way that a doctor could. That's what this is enabling.
Okay, thank you for.
Yeah, you've listed the most likely candidates, but yes, but it's possible for more.
Okay, thanks for that clarification. My second question will be more on the bilaterals. You have unfinished bilateral agreements on rare disease and pharmacare with at least some, if not all of the provinces. We don't know if there's going to be an election in 3 months. What do you feel like your timeline is as health minister to get these done? Is it possible that some provinces could receive funding under bilaterals and others do not?
Aussitôt que possible. I am sprinting. Being here today, I really appreciate the government of Saskatchewan and Jeremy for being able to work through these details and get this announced. This is extremely important. I talk about radical incrementalism. We have to make this progress. It wouldn't matter to me, to be quite honest with you, if there was an election 4 years from now or 2 weeks from now. I think people, just take a look at these people who work here at this hospital. I got an opportunity to do this tour. You want to see you want to be inspired, walk around and look what they're doing every single day. And I think the only thing that they would ask of somebody like me is do as much as you can, as fast as you can to make things better. And I don't, tomorrow's a promise to no one. I don't, there's no guarantee I'm alive tomorrow, let alone the minister. So I have to make do with whatever daylight I have to get whatever done I can get done. And so, yes, you're absolutely right. We have these agreements that are so important on drugs for rare diseases. It's essential that we get them all done. I'm feeling very good that there'll be a number of more, and I'm very hopeful that we can get them all done. On pharmacare, this is going to be up to Parliament. I absolutely work so close on a number of agreements, and I'm really looking forward to announce them. I think it'll be extremely exciting. But it's going to be up to Parliament. We elect Parliament for 4 years. Everybody's, let's have an election, let's have an election. Why? Every 4 years you get an election. Democracy's not going anywhere, folks. There's going to be an election. But we got stuff we got to get done. And I certainly, if I was a constituent and somebody who cared about health care, I'd be talking to my MPs and say, really, you're going to cause an election in May or June instead of October because what? You think it's better, you might win more seats, right? That's your calculus, that it's better for your party to have an election now? like, we have a set election day. Shouldn't we use the set election day? Shouldn't we use the time we're given as parliamentarians to get things done? And I can tell you, if I'm given to October, I'll get all the pharmacare deals done. I believe that. Now, Jeremy's sitting next to me. He could disagree, and that'd be totally fair, right? Because I got work to do, and I don't want to put him in an awkward position. But I really believe in this. I don't believe in it because I'm a Liberal. I believe in it because I'm a Canadian, because I think it's the right damn thing to do. And so I think having that time is important. And I'm hopeful that it's there, but I'll make use of any time I'm given.
Thank you. Now we have a question from Dane Patterson with CBC News.
Hi, just
Go
a
ahead.
question for Minister Cockrill. If you folks can hear me.
I can hear you, yeah.
Just looking for a bit of clarification. I think you'd mentioned that this deal, some of the drugs already covered, or in this deal already covered from the province. Did I hear that right? And how does this new agreement kind of change how?
Yeah, thanks, Dane. So these three specific drugs that we're talking about today, they are on the Saskatchewan formulary currently, which we provide coverage for under our provincial plan. However, you know, what this agreement today does helps us to ensure that we're expanding coverage really for, and looking at adding more drugs down the road to address other rare diseases that affect children and patients of all age. So really, I think what it shows is a commitment on behalf of our government to be working with the federal government to, again, make life a little bit easier, to lessen the burden on those dealing with these rare diseases.
Okay, sorry, just to clarify then, so are there going to be more people that have access to it, or what is, I guess, the practical change?
Yeah, so the practical change for folks that are already on these drugs in Saskatchewan, I mean, that coverage will obviously continue for those patients. You know, there was a question earlier today about screening and diagnostics. As I said, that's something that we're continuing to work on in our province in terms of expanding those services. But really, you know, and I've had many conversations with constituents, both in my own community and in communities around the province, you know, on specific drug requests that they're exploring personally with their healthcare providers. I think what this agreement does is it opens up the opportunities to have more discussions, again, with the federal government on, you know, expanding what drugs are available to residents, whether they're here in Saskatchewan or elsewhere in the country.
We do have another question from Tessie. You can go ahead.
No, actually, we need to stop. We have a flight to go catch. Thank you, everyone.
Thanks, everybody. Really appreciate it. Yes. Oh, yes.
Thank you. We're going to ask the MLA to come back up. Everybody just stand on the podium. We're going to be taking some photos. But the MC will come back up. And go ahead.
Okay, I would just like to thank everyone for coming to celebrate the greater access to health care for Saskatchewan residents and that they will have, thanks to this federal funding. Thank you.
Thank you. And we will now have the two ministers please come and sign. And just right here. Sorry.
Sorry, excuse me, I'm just kidding.
Ministers, if you could go back on the podium and we'll just take a group shot. And I want to thank everybody for coming.